It is really sad that my arms are not that sexualized, but my breasts are. My breasts are sexualized even though men possess the same organs. We just have like a hormonal difference, so of course they look different, but they're just the same.
Welcome to the Find Your Ultra podcast. We've been doing this for over 10 months now, and this podcast has given me a great opportunity to sit across with some amazing people and have some amazing conversations. This has been rewarding, but it is time now to take this to the next level. I know this is not going to be easy. It hasn't ever been easy, and it will never be easy. I know that for sure. But the subject of today's podcast is important enough for us to at least give it an honest try. I was less than 10 years old when my next door neighbor aunt passed away due to breast cancer. I wasn't very close to her, but I was to her children, and I was very good friends with them, and it was painful to watch them go through that trauma at such an early age. Yeah, it was painful, but we lost her. And then what happened? Nothing. Like, no conversation, no mention of breast cancer. No one educated us about it. No one talked about how it happens, why it happens, and what can be done about it. So when UV Can Foundation reached out and said they would like to use the Find Your Ultra podcast platform to spread awareness about this cause, I jumped out of my seat. I said a yes without a second thought, and I also wanted to do a really good job of this. So we decided to record a video. And it is clearly a new beginning for us, and what more important than a subject that can directly result in saving lives. So please listen to this and watch it till the end and share it with the people that you love. To have this conversation, I have with me Purnima Bisht, who leads the breast cancer awareness program at the Yuvraj Singh Foundation. The foundation is called UV Can. UV Can Foundation is active in the area of cancer control across the country. It does a lot of work in that space, and a part of the same is this initiative of this collaboration, which has resulted in this episode that you're about to watch on YouTube, or if you're on Spotify, that you're about to listen to. In this conversation, we talked about the signs of breast cancer that you and I need to be aware of. In fact, every person listening to this needs to be aware of. We also talked about the stigma around this subject, which prevents it from being discussed during our home conversations, our household conversations. And we also talked about why it's important for all men to join in the conversation and be a part of the solution. And lastly, we talked about the exact steps that you and I need to take right after we stop listening to this podcast. So without further ado, let's dive right in. This is Purnima Bisht and me in the Find Your Ultra podcast, episode 32 if you're on Spotify, and episode 1 if you're on YouTube. Indulge away. Welcome to the show, Purnima.
Thank you so much, Vipin. Thanks for having me.
You're welcome. So, Find Your Ultra podcast is about helping people maximize their potential. It's about inspiring them and empowering them with certain tools that help them chase after their dreams. But you can't really do that unless you're in good health and everybody in your family is in good health.
Yeah.
So health is definitely an important part of this. And what we're about to discuss today is a super special. This is a super special episode because of the importance of the issue that we're going to discuss. So we're going to learn about breast cancer from you today. Cancer has almost become a word that you can't say, right? It's become the C word.
Yeah.
No one wants to say it, no one wants to talk about it, no one wants to hear it, no one wants to face it. But it's almost like refusing to talk about it or discuss it. It's almost like closing your eyes and hoping the problem will disappear,
Yeah.
which is clearly not going to happen, right? So we are here to fix that. And what amazes me about this illness is that a lot of it can be, like, at least the mortalities, the deaths can be reduced significantly by prevention,
Yes.
by taking some preventive measures, and by early detection. The numbers that can be stopped from progressing are staggering. It's a shame that we don't talk about this and we don't discuss this and do anything about it. So we're here to fix that. Like I discussed with you when I met you first, I first heard about breast cancer when I was a child. I must have been 7, 8. And my next door neighbor auntie passed due to breast cancer. It was all super saddening because, I mean, of course, my attachment was not with the woman that passed. It was with her children. They were my friends, and to see them go through that was very traumatic. I look back at it and it amazes me how at that time also we as children not told about the cause of death. Like, we heard it through some children who had overheard some adults talking about it. तो हमें पता लग गया. Otherwise, adults wouldn't even come and tell us that it was breast cancer that took her life. So it's so stigmatized. Like, there are just so many layers to this whole problem. I am so glad, it still gives me chills as I talk about it. So I'm so glad we are talking about this. I want this to change. I want my audience to have complete knowledge of this and the steps that they can do to help in this cause, and make sure at least all the females around them and the ones that they care about can avoid getting this or prevent it, or have early detection and improve. So let's begin. I mean, before we talk about anything, just to double click on the severity of this problem, do you want to share some stats around breast cancer?
Yes. So it's so unfortunate that we live in a world where something like this is just such a prominent, like a lingering disease at the back of every woman's mind, if she is aware, that is. And if she's not, then she is already the weight of the weight of the disease already lingers around her. But there was a time when people used to pass away due to cancer. People that are parents or their parents, and there was just like 2 in 10 people would probably die because of cancer. And us time it was mostly like communicable diseases were like kind of the wave. People used to get TB, people used to get malaria, HIV. You transmit from one person to another because people used to just live so close together, and that's how they would transmit it to each other. But now we're entering almost like a paradigm shift where there is sort of like the communicable disease wave has now transferred to the non-communicable side of it. So even though the population is growing and people are living much more closer to each other, the fear or the threat of life or disease is now more towards our lifestyles. Which is why every person that I know today, and if I speak to them about cancer, they will never bring it up as a table conversation, as a dining table conversation, because like you said, we don't want to talk about it. And the moment we talk about it, it almost feels real that it is happening, it is that problematic, it is that prominent. But our lifestyles have just somehow made us shaped us in such a way that there's no running past it. We have to address it, we have to fight it. And the highlight is that you can fight it. Like at UVCAN, where I work, we go by this line where it's fight cancer, and that's not something that we usually hear. I mean, sure, we see them in movies and we're like, this person who suddenly gets cancer, and immediately the doctor's like, he has cancer, and the patient's like, how many months do I have to live? And the doctor's always like, you don't have a lot of time, and cut to 5 months later, dead. That's what we know of cancer today. And a lot of people who do not come, who are from the academic backgrounds, will never go out or read a book about it or read a research paper about it. Which is why it is so important for people like us to have this information, to pass it on to the people that we know. That maybe this is not what cancer is all about. It is not the C word. It is just as bad as any other disease that there is. But the only difference is that with the right time, if you detect it at the right time, you can save your life. And if it's not you, maybe if you're the lucky one, and you may think it's never going to happen to you, and we all think it's never going to happen to us. We all, anybody who smokes a cigarette, lights a cigarette, knowing that it's not going to happen to us. Or even at the back of their mind, they think probably it will, but then I'll deal with it. You only live once. YOLO. We love living on the edge, and that's all right. I kind of understand that. But it's important to not turn a blind eye to this information, which is why I think with this conversation, maybe we can try and let people know that the information is just that simple. And if we just talk about it, and if we just try not to turn a blind eye, or try to just avoid this conversation because it just makes us too uncomfortable. It makes a lot of men uncomfortable, and because of that, it makes a lot of women uncomfortable. Like you said, like the adults in your family were just too hesitant to tell you that it was breast cancer that took her life.
Can you, like, looking back at it, can you imagine, why wouldn't you tell anybody?
Yes. I was talking to my friend about it yesterday, and I realized that a few years ago, if I was in the same position, not where I am right now, but if I was in the same position where I have to talk to somebody about breast cancer, I would find it awkward saying the word breasts. Saying the word breasts almost just suddenly makes it sexual, like has a sexual connotation for a lot of women and for a lot of men. And I do not blame them directly for, putting.
That's the conditioning, that's the context in which we've heard of them. And
it is really sad that my arms are not that sexualized, but my breasts are. My breasts are sexualized even though men possess the same organs. We just have like a hormonal difference, so of course they look different, but they're just the same. But when I talk about breasts, and I have to talk about breasts to a man, it almost makes me just like, I almost have to like whisper it, because I just can't say it like in normal conversation. So what we're doing right now is sort of trying to, put a drop in the ocean to sort of ignite this revolution that why can't men and women have a conversation about this? Me with my friend, me with my father with his sister. Of course, that's that's a shot in the dark. I'm not going to deal with the generation that's gone past, but I think the generation to come. So I think it's really important. And like you said, there's a lot of stats that go around on papers globally, Indian. But if you're talking about our Indian audience specifically, the numbers are really, really saddening. I mean, as we speak, there's one woman that is diagnosed with breast cancer every 3 minutes. And I'm only talking about the women who make the effort to go to see a doctor and get a diagnosis on paper. And those paperwork documentation make it to those registries. So that's 3 minutes. So I mean, by the time that we've chatted up, I don't know how many women have found out this really alarming and saddening news.
And then testing rates are so low.
So
given
low.
That, are there any extrapolations around what that number might be, like in terms of the real actual numbers on ground?
I think
the ones that are not being tested.
Definitely, there could be some projections around it that this percentage of cases are probably left undiagnosed or underreported. But that's the thing with those underreported numbers, we will still never know. It will still just be a number, but we're so sure that the number is so much more than that. And that's one woman every 3 minutes getting diagnosed, and that's one woman every 8 minutes that succumbs to this disease. And that is all because, and all stats around the world, whether it's India, whether it's Africa, whether it's first world countries, two of the main reasons why, scientists and us as health experts believe what has been the major contributor to this has been just two things. And you won't believe me how stupid that sounds. It's the lack of awareness, lack of just the mere information that this is what puts me at risk, this is what puts me at more risk, and this is what probably the signs of breast cancer look like. And maybe the moment I see them, I should rush to a doctor. The fact that we do not have this information means that a lot of times when we will encounter something problematic or painful, women, they will brush it under the carpet. They will sleep over it. They will tell themselves to snap out of it because they'll just, the pain is just so normalized in the lives of women. As women, when we are born, the journey of that pain just starts and it just keeps on changing. It's changes the way it looks and it feels. And the women that we work with and the women that we talk to, they talk about, and when we go and deliver these awareness sessions in tribal villages, even with women who work at the top companies, and you would assume that they know better, but when you show them what these signs of breast cancer may look like or may feel like, you will always see them alarmed. And half of them have told me that, oh, this looks familiar, which means that they have either experienced it or they have spoken to somebody that they know who has experienced it. So it is all that prominent, but with the lack of that information means that I will never look at myself and just be like, oh, maybe I should just go see a doctor right now. The lack of awareness is one, and the second is lack of regular screening. So breast cancer screening is one of the biggest modes of detection at early stages for breast cancer. But unfortunately, in terms of our government infrastructure, it does not exist as much as it should to kind of deal with the population like ours. And a lot of women are not aware of how to examine themselves at home to be able to know that, okay, this is not normal. This is definitely not normal. Maybe I should talk about it to my husband, because of course we are still privileged. So you talking to your wife about it, or me talking to my brother or my partner about it, I'm going to be very comfortable being like, hey, this is what's up. But when I'm talking about this random woman in a village in, say, Bihar or in the south, they're gonna probably think about it for a lot of weeks before they tell their husband that I think there's something wrong with my breasts. Just that sentence, that mere sentence will give her the biggest nightmare of her life. Like, how do I go and tell my husband that there's something wrong with my breasts and it needs attention? It is just that simple to detect it in time. But still, breast cancer remains one of the biggest.
Sorry to interrupt.
Yeah.
Just why are they so scared of talking about it? Especially when it, like, why can't they just report it to their partner? Why don't they?
I think in an ideal world, I would love for them to just be like, to be that transparent and that honest about what's going on with them. Had it been a knee or a joint pain, had it been acidity, had it been a headache or a backache, that is such a casual conversation, in Indian households. Oh, I'm feeling acidic, I'm feeling gastric, feeling nauseous, oh, I have a fever. We're so used to these conditions. But when it comes to this, and I'm not saying that any woman who will face any discomfort in her breast will know that, oh, she's going to die of breast cancer. Of course, she's going to be scared, because the first instinct is when you feel something painful and you don't know what it is about. It is natural for you to think all of these things, all of these demonic things, and just be like, okay, my time is up. That is misinformation. That is lack of information, or whatever little information you have, it's misinformed. So she's already a woman who is facing some kind of a difficulty, already thinks something bad is going to happen to her. Now, second, she thinks that she'll have to break this news to her husband. And I'm not going to say very confidently that all of these marriages or all these relationships are the most healthiest around the world. Of course, relationships aren't perfect. So I'm sure there are multiple reasons what keeps her from talking to her husband transparently about what's going on in her mind or what she's thinking about. Of course, mental health is a completely different, conversation altogether. And now we're saying that this is something that she is already concerned about, but she doesn't know what it is about. So there's a lot of questions in her mind. She's scared, she's confused, she has her doubts, and she also doesn't know if her husband is going to react to it well. Or she doesn't know if I'm going to tell my husband, he's going to be like, you know what, just pack your bags, we're going to go to the doctor right now. Because in most cases, the women that we've spoken to, a lot of the times these men have been like, I'm not losing my day wage just to take you to the doctor that's 15 kilometers away. I mean, I can still call a doctor home for a test or a technician home for a test. That's my privilege. That's our privilege. But for the larger part of our society and larger part of the women that exist in this country and even other parts of the world, I don't think they have that privilege. So a lot of times they get to hear stuff like this, that I'm not losing my day wage on you, or we don't make that much money for you to spend that much money on an ultrasound only to find out that all's okay. So we'll go to a doctor when it's just that worse.
You must.
Absolutely when you must. So that's almost saying like, wait for the disease to manifest itself to a point that you actually see it physically, and you see that what is wrong, and only when you know that this is wrong will we decide to go to a doctor. Uske baad bhi they will deliberate over it, and then they will decide if it's worth spending that many bucks or losing a day wage to that. That's just saying that, I'll just wait for you to get on the death wish, because every week that passes by, I can't even imagine the kind of negligence that there is. I mean, what a little lump or a 0.1 mm lump that woman must have felt that day, which was hurting, and which was hurting for a few weeks now, and now 3 months have gone by, and it has grown in size to a point that now it is physically visible over your breasts that something extra is like, growing in your body, and only then will they go to a doctor. So women do not possess the health seeking decisions that they would take for their own bodies, for their own lives, because they feel that they owe it to their husbands and they should make that decision for them. So it's important that men also know that this is that you should not be waiting any longer when you see a risk or a sign like this. So the lack of information is both ways, I think. Men and women.
Yeah, so a couple of points I want to just highlight because I've experienced that firsthand. One thing that you mentioned is people don't want to get checked because they also fear कि पता नहीं क्या निकल आएगा, right? Fear of the unknown. I've seen a lot of people feel that, and that is also the reason why a lot of women and men also in tier 2, tier 3 cities in India don't go for blood tests and stuff like that. They'll say जो नहीं पता है वो ज़्यादा अच्छा है, उसमें पता नहीं क्या आ जाएगा will be a bigger problem. But wouldn't you want to know what's there? Like if it's like just not knowing it, if there is a problem, just not knowing it will not solve it. The other thing that I want to say was if me living in New Delhi and we are sort of this is urban India, this is the heart of the country, right? This is the capital of the country, capital city. If I have never spoken about this to anybody, I've never discussed this with my wife. My wife hasn't discussed this with anybody. Like we haven't had this conversation. My mother, I don't have a sister, but brother, father, this is not something that we've ever talked about. So अगर दिल्ली में ये चल रहा है तो I'm pretty sure problem बड़ी है, right? So we do need to be comfortable about talking about this. Let us understand this a little bit better. What are the ways in which UV Can Foundation has been going about this problem?
So the foundation itself started off with an initiative to empower the country and the people of this country to be able to fight cancer through early detection, through the right information, and through the treatment support, and to kind of support the people who get diagnosed with the disease to survivorship. Because diagnosis is just one part of it, but we have to support and handhold them through to survivorship. But that's only going to be possible if you detect it in time, right? So that is when we decided that what are the areas that we should work on the most. So we started with a lot of other programs. We started working with kids. We started working in oral cancer. But we realized that we studied a little bit about women's health and the importance of women's health, women's and maternal health, and the whole story. And we realized, when we did our math, we realized that in India, 56% of the cases are just breast cancer, and that's 2020 because of lack of awareness and early detection. So we designed a program, and we wanted to pilot it. We wanted to define the problem. What does the problem look like? We wanted to devise a solution for it, and we wanted to see that if the solution is feasible, is it sustainable, and is it scalable? So if I am trying to pilot it in one city, if it works, do I think that can I replicate this across the country? So we started our pilot project called Swasth Mahila, Swasth Goa. We work with the government of Goa in partnership with SBI Foundation. So we do that to kind of ensure that, by the name, it says a healthy woman is a healthy Goa. So, and why we devised that name was so when somebody gets cancer in a family, it's not just a personal journey of, pain and misery and hurt that I go through. It affects the whole family. It affects the whole family, and it affects the whole household, and it affects the whole city, and naturally affects the whole country. So Swasth Mahila, Swasth Goa was our little baby project. We decided to roll out with the goal to screen 1 lakh women for breast cancer. And our solution was pretty simple. It was a three-step program. We wanted to make it into a program that even organizations around the country, because of course UV Can around the country cannot be at every place. So we wanted to kind of make a product that works. So our first step I mentioned, importance of information. So we start with our 3-step approach, which is the first being educate, second being detect, third being empower. So by educate, we intend to educate all women that we meet and we speak to on what is breast cancer, what puts them at risk for breast cancer. Certain risks are modifiable in the sense they have some control over it. Certain risk factors they don't. And the fact that some factors that they don't have a control over does not mean that they can't do anything about it. That just goes to show that you need to be a little bit more conscious and more self-aware of what's going on in your body. So that's our educate. So now once we've educated them that this is important, what puts you at risk, importance of screening, getting yourself screened. If you're under the age of 40, of course, you still need to examine yourself and be, aware of your bodies. But women above the age of 40 are actually at high risk for breast cancer, naturally because of the age component. So now that we have made sure, and now we make sure that they know that this is important, and we created a need, that is when we hop onto the second step, which is detect. A lot of times we know that these women are not going to spend their money, their hard-earned money. They're not going to make that trip to the hospital just so that they can go get a test and only find out that, hey, all's good. And then, hear from her husband that, I told you, you wasted my time. And so now what's going to happen is she's going to be more scared. And the next time, because if I get screened today and I'm completely normal, that does not mean that 3 months later I cannot be at risk. I'm always at risk. As a woman who's aging as we speak every second, I'm at risk just as much as all women. But of course, some women are at more risk because of the risk factors that they are exposed to. So we screen these women by making that health service available to them at their doorstep. So that's what at Public Health, that was taught to us. And that's why I got into this profession in the first place. Because I know there's just way too many people in this country who will not who cannot access the hospital in the first place. And even when they can, there's some deterrent that's keeping them away from it. So when the common man cannot get to a hospital, you have to bring the hospital to them. And by hospital, I do not mean the infrastructure of the whole building, but sometimes it's something as small as a resource like that, which is making sure that these women get screened. And we do it free of cost for them, so they don't have to worry about spending that extra buck on it. And once we find out if there are any suspect cases, by screening is not a diagnosis. So which means that every woman who does get screened will now know that if I am at risk or not, if I'm suspected for breast cancer or not. The only confirmatory test for a cancer is a biopsy, and that cannot be done, unfortunately, because of the resources that's required. I cannot go home and take a biopsy of every single woman. So, but then now we want to make sure that now 1 lakh women that we wanted to screen in Goa, 1 lakh women are not going to the hospital to get a biopsy. Only that certain little number, only say 40 women who were suspected, and only out of them only 10 women who were suspected positive have to now go get a biopsy. So we're not even kind of burdening the health infrastructure either, because I know it's very easy to just be like, the government does nothing for us, the hospitals are a sham. I mean, a lot of it is true, but we have very limited resources. The resources are limited, and we're all trying. But of course, the population just makes it so hard to, deliver. So when these women who are screened and are suspected and have been confirmed that yes, unfortunately, you have been diagnosed with breast cancer, they are pooled and routed into the treatment system. They're assigned a doctor, and their whole treatment schedule is drafted up. And in Goa, all of these women undergo cancer treatment free of cost at all government facilities. And but that's only for the residents of Goa.
That's commendable.
So I think all the things that were keeping this information away from people and keeping this elixir of kind of saving their life, all the things is what we tried to capture. This lack of information, I'm going to tell you what it's about. You have a challenge, I'll tell you what to deal with it. You can't go to the hospital, you can't get yourself screened, you have this reason. Of course, excuses, but I understand. So what I'm going to do is I'm going to bring this to you. All I need you is to just give me 15 minutes of your time, get yourself screened. Even if you're all right, It's at least now you have information about your breast health. I mean, breast cancer is not just the only thing that's coming out of this process. I'm still getting to be aware of my breast health, something I would have known otherwise. Because what goes on inside our body, we don't know. And the third one was, okay, now that I have cancer, a lot of people, like you said, who do not want to address the fact that कि मैं test करवा लूँगा तो कुछ 2-10 बीमारियाँ और ही पता चल जाएंगी. The closing remark for that was just that we want to make sure that if there's anything that's keeping people away from this, if it's the fear, if it's the stigma, if it's the discomfort, then those are exactly the things that we need to target. And that's what we've tried to do with this program. And we've seen that it works, which is why we're creating a bigger initiative called Swasth Mahila, Swasth Bharat, to see that, all the women in the country, if we're losing the precious lives of the Indian women all to a disease because they just don't want to talk about breast because they're too shy, if they're just too shy to talk about it, and if the men are just too shy to hear about it, then I'm sorry, then there's something that we're all doing wrong and that needs to change.
No, I think, and it's not just the women being shy, because let's say you're not comfortable talking about it with anybody apart from your mother. And what if your relations with your mother are not very good? Then you don't have anybody to talk. So, हमने जो माहौल भी दिया हुआ है ना, it's not normal to talk about this. That needs to change. Which brings us to the point that you mentioned before, a couple of days ago when we met, that you need to bring in men into the conversation. It is such an important step. Why do you think it's important for men to come into the conversation? And
because I know as a woman, women like to talk. We like to talk to our girlfriends about it, to our mother about it, to our sisters about it, if the environment is, like a safe space to talk about. So I know that I am going to talk to somebody about it, at least one person. But sometimes, life is unpredictable. Like you said, maybe I don't, or maybe this person does not have great relations with her mother.
And also just Indian women in particular are known to put themselves last. They would look after everybody in the house. Like the simple example that I've given to a couple of friends is like, if my mother makes food for me, right, my paratha will be perfect. It will be perfect, crispy, golden brown, as it's supposed to be. If it's not, to ek aur ban jayega. Right? But look at whenever she's eating, her food does not have to be anywhere close to perfect. Jala hua hai, aadha hai,
even the presentation of the plate will just be so different.
Like, don't care. Apna to comes absolute last. Like, first is my husband, then children, everybody else in the family, elders. I am the last, absolute last. So they are wired to not look after themselves, and that needs to change because a lot of families are suffering because of that. Like you need to put yourself first, because the entire family will actually be spending the second half of their lives looking after you then. Like you do need to put yourself first.
And if there's daughters in your family or another woman in your family, she's going to look at that and she's going to mirror it when she grows. So no mother will actually tell her daughter, put yourself last. She's not going to say those words, but she's going to do exactly that. And that's what the daughter is going to see. So it just becomes so instilled in us that my husband matters more, my kid matters more. And if I'm talking about a woman in a village, and if she only has $50 to spare for the day, and if her kid is sick, kid is coughing, she's going to take a bunch of that money and she's going to put it on the fare or on the OPD fee for her kid, even when she is like dying from excruciating pain in her, breasts that she's been living for months now. We've spoken to people who literally, there's a woman who literally has a huge ball-sized lump on her breast in a village in Rajasthan, and she still sleeps in peace thinking it's all right. She knows it's not all right. So she is definitely denying it. But she's like, if I'm going to go to a doctor, they're going to tell me something. I'd much rather die of it than know. Which was so funny. She's like, what am I going to tell people? That I have breast cancer? So just like I said, just saying that word breast just gives them, like, they want to run for their life because they don't want to be known as somebody who died of breast cancer, which is just so sad. And I don't even blame her fully. It makes me really mad when I see women who say things like this. But then I try to introspect and I realize that this is not really her fault. And why is she so upset about it is because in a society that we live, that is dictated a lot by, so a woman feels that her breasts, her bodies are made for the male gaze and the male gaze only, and her breasts are sexual in nature. So anything related to the breast, or even saying that word for that matter, is just going to make her shy, it's going to make her hide, it's going to make her just be like, how do I tell my husband that there's something wrong with my breasts? And what is he going to say? And then when she goes to a doctor, the husband is probably going to be like, so what are they going to do? So a lot of men think that, when the woman is going to go to a doctor, there's somebody who's going to touch her, and there's somebody who's going to find out, and that's the only clinical way to find out if you clinically examine breasts. But that's going to make the man uncomfortable, or some sort of like an ego or a patriarchal, like the evil, the evilness of the patriarchy, where he's just going to be like, oh, so somebody else is going to touch your breasts? I'm not going to let that happen. I'm just thinking like the internal monologue that the man would have. And all of these are baseless. These people will not sit back and think about why is that important, but they will just see the surface level and they'll just be like, nope, no. Or they would just not understand the seriousness of it.
Have you had any conversations with any men whose wives or somebody in the family has been diagnosed with breast cancer, and like, have you talked them through the whole process of examination, and have you seen anybody change their view or attitude towards it?
Yeah, their attitude changes when they find out that she does have breast cancer. And then they're like, oh, and that's when the whole journey starts, because now they have no other option but to accept it, because it's right there on paper and the doctor has said it, and it's on the report, and it's now physically manifested. Now I can physically see on the breast that this has gone way too far. So of course, somebody who probably had a different opinion pre-diagnosis and would probably just cough it off as whatever, will deal with it when it gets really serious, versus diagnosis. So of course, the men that I've spoken to post-diagnosis, they don't have much to say. They don't want to engage in a conversation really, and they're just like, ab to ho gaya hai. Then they express the, the lament and the hurt, or the disappointment, or the financial cost of it all, everything. But just that 2 minutes of discomfort, sitting in that discomfort when your wife told you about it, and to just be like, okay, this makes me uncomfortable, but this sounds serious. Let me check it out. Let me take her to the doctor ASAP tomorrow morning. That is a thought that doesn't cross a lot of men's minds. And that's also because they don't know enough. They don't know if it's that serious, which is why I think a conversation like this, a man and a woman, having a conversation about this just as much as we would like to have a conversation about the damn weather. It's like, why is this so looked down upon? Why does it make you so uncomfortable? And if it does, that's a personal problem for each man to go home and think about and reflect about and be like, this does not physically concern me, but this still concerns me because this is about the person that I really love. If it's my sister, if it's my mother, if it's my wife, it should be something like when you were 6 years old. If you knew, I'm sure when you would have grown up eventually, you would have gotten curious about it, and you would have started informing yourself about it, reading up about it, talking to people about it.
No, not really, because that environment was never really given. So that happened when I was a child, and we all brushed it off under the carpet, and nobody ever talked about it. And then suddenly after, I'm 39 now, and I speak with somebody from UV Can Foundation, and they talk about breast cancer, and then it all comes back to me. It's still not normalized and talked about, which is what we are here to fix. So I don't want also to all the women listening to this get scared. First of all, let's talk about how to do a self-screening. Do you want to talk about that? And also whatever you see or feel, to not jump to conclusions and take it like be poised about it, and you should guide us how to do that.
Yes. So it's pretty easy. So whenever we go about talking to women about this, we try to keep it pretty simple. We usually do a demonstration for them where we demonstrate how to examine yourself at home. Of course, you will not be able to really screen yourself because there are a lot of personal biases when we examine ourselves. There's a lot of, if somebody's doing it wrong, then they're just going to think every little tissue or the muscle in their body is a lump. So we prefer that every woman once every month, after 2 to 3 days after her periods are over, for women who are menopausal, so who do not get their periods anymore, can pick any day in a month, literally religiously take that day and only take out 10 minutes of your time. And I think we all deserve to take out 10 minutes of our time in the entire month to just look for certain signs and feel for certain lumps. So as per science, we believe that if you know what the 10 signs of breast cancer look like, and if you can feel for any kind of lumps in your breasts, half of the battle against this disease is won. Because when you feel or when you see anything alarming or anything abnormal, remotely abnormal, you'll pick up your bags and you'll see a doctor instantly. And when you do that, you'll be able to pick anything that is wrong, that is probably malignant in time. And when you get diagnosed in time, your first stage, 2-stage cancer survival rate increases to up to like 80 to 95%, which is remarkable in breast cancer. And it's a chance you need to take, but that's only possible if you do these two things. And I think both of them are really possible at the privacy of their own homes. They can just, when they're taking a shower, take out 5 minutes of your time, 10 minutes of your time in the shower, or when you're going to bed. Those are the two ideal times. So, like I said, pick a date, take out 10 minutes, either in the shower or while you're sleeping, and just examine your armpit region. So, it's your entire armpit and your entire breast, both sides, is what you need to examine using your 3 fingers. This is called a 3-finger test rule. So, you take 3 fingers, the cotton pads of your fingers, the soft parts, and you take these 3 fingers and you examine your entire armpit. So, you take your hand up and you just examine the whole thing, the whole portion. We often miss a lot of our armpit area, but that's where the lymph nodes exist. That is where all the blood supply comes in. A lot of women ignore that, which is why a lot of lumps in the armpit region have started coming up a lot as the site of cancer. For breast cancer in a lot of cases, because there's a lot of fat tissue here. So, जहाँ पे भी fat tissue है, वहाँ पे lumps बनने के chances हैं. 80% of the lumps that women might feel, whoever listening to this are going to examine themselves and they're going to feel something and they're probably going to be like, oh no, I feel something.
So lumps are common is what you're saying?
Lumps are common in South Asian women, especially because we have denser breasts. So wherever there is fat tissue, there is going to be chances of lump formation, but that's just accumulation of fat. So 80% of these lumps will be benign, but the 20% that might not be, but might also feel benign. Because of course, me as an expert, I will know what a benign lump is and what a non-benign lump is. But women at home probably do not know that. So I would advise for them to not go at home, examine themselves, feel something weird, Google it, and for Google to tell them, yo, you have cancer, bye-bye. Yeah. And that's what a lot of women are going to do. At least the women who are like tech savvy, they're going to Google it, which is why we advise to not Google anything, not diagnose yourself, not self-undiagnose yourself where you're like, oh, 80% of lumps are benign and probably I'm the chosen one and my lump is benign and now I'm going to sleep in peace. So the moment you feel something abnormal, if you see something abnormal, there are a lot of signs that might not look like lumps, but they are signs of breast cancer. They get ignored a lot because the kind of conversation and the narrative is such that lumps equal to breast cancer. But a lot of people who do not have lumps also are diagnosed with breast cancer. And they look differently, and it's all available on the internet. Because of course I can't verbalize what these signs look like, but they all look abnormal. They all look what a normal breast does not look like. And the moment you see something alarming, you need to not Google it, not talk to your friend about it, and if your friend tells you, oh, there's nothing to worry about, you probably just slept wrong, or you probably were just wearing an uncomfortable undergarment, and probably that's why you're feeling pain. If my friend says it, I'm just going to be like, oh, okay, all's good. But she's not a doctor. She's not a health expert. She's not an ultrasound machine or a mammography. So I cannot trust her word for it. So the moment I feel something remotely weird that did not exist a month ago, that did not hurt a month ago, I need to take my bag and I need to book an appointment and see a doctor instantly.
Where can we find one?
So all government hospitals or private hospitals have breast oncologists, have gynecologists who can examine it for you too. You don't need to go to a breast oncologist right away, but if you have family history, if you are above the age of 40, if you are a woman who has never been a mother, who is nulliparous, who has never conceived, who has never breastfed, things that increase your chances
So
or risk.
breastfeeding reduces your chances
Yes,
of
yes,
getting a breast cancer.
yes. That helps in a lot of shedding of dead cells when you breastfeed your baby. So of course it's great for your baby's health, but it has twin benefits as it also helps in saving the lives of many mothers. It is not a common practice here in India for a lot of women to breastfeed for at least 1 month. So mothers who haven't breastfed for at least 1 month, their risk for breast cancer increases. So if you are under these risks, maybe you should see a breast oncologist regularly once every 3 years. Okay, but you should keep on self-examining yourself. But if you're above the age of 40 and if you're a woman who is approaching her menopause and has somebody in the family who's had breast cancer, which means that there is a chance that you might carry the genetic mutation, you should get a mammogram once every 2 years without fail. Absolutely.
So now that we know what we know about breast cancer, and now that we also know that it is really important for men to get involved in the conversation, a lot of my audience right now is men, right? And I'm pretty sure a lot of the audience of UV Can Foundation also will be men. All the men listening to this, what do you want to tell them? What should they be doing? I want specific action points for myself to begin with. Right after this podcast recording, what should I do? Who should I call? Who should I meet and say what and do what?
Well, to keep it very simple and easy, I'd just say, to all the dear men that are listening to this, 2 things. First is, right after you're done listening to this conversation, pick up the phone, talk to your mom, call up your girlfriend, speak to your wife if she's around. Just talk to them and ask them if they're okay, and to just let them know that you want to create a safe space for them to talk about there's anything that's been bothering them, whether it's physical, mental, whatever. It's very important to create that safe space so that the women will come in and share it with you. Of course, you're not going to have this conversation with them on gunpoint. So tell me about if you have experience. Yeah.
No, that's...
So of course it's going to be like a very like an alarming question, like catching them off guard. But create that safe space. Try to talk to them about their health, about their body in sensitive ways instead of triggering ways. Be sensitive about the words that you use and let them come to you. And when they come to you with a small inconvenience, that's when you start the conversation. And when you start that conversation, do it freely. If you have any questions about the female body or about this, that you think your wife or your sister or and a female that would be willing to talk to you about, let them come to you on their own. Create that safe space for them. 2, if you already have that safe space with your partner, your mother, your sister, your colleague, if you have that safe space and you're confident.
All the females in your life.
Yeah, all the females in your life. And the ones that you're even going to get to know.
Yeah.
Ask them, when was the last time they got screened? A lot of women who might have been hearing this for the first time, educate them. Tell them how important it is. Let them to start thinking about it. And when they come back to you, engage in a meaningful conversation about it. Push them, motivate them to go. If they're scared, they don't know what's going to happen. If they don't know, if they need a companion or a partner or somebody to go with because they're just too scared, tell them that you'll take them to the doctor.
Yeah.
Or you're okay to go with them whenever they're ready.
Yeah.
Don't push them. Try to create that safe space both verbally and physically, and to just motivate them to start reading up about it, taking care of their own health, reading up about what are these risk factors and the importance of screening, and and letting just for everybody to know that we all think it's not going to happen to us, or something bad is not going to happen to us until it does, and it's often way too late when it does.
Yes.
And we're like, I wish I read that damn emailer that I was getting on my promotions, and just read what they were talking about, because it's Breast Cancer Awareness Month in October. So, organizations like us around the world, corporates, are sending out these emailers that we just do away with.
Yeah.
Sometimes it's just that 2 minutes of our time that could really change our lives. So I think it's very easy. I think all men can do that if they want to. But first of all, if talking about this or hearing about this does make them uncomfortable, they should sit back and think about it and really ask why, and just ask themselves how can they be better, because breast cancer is not just a health issue. It is a feminist issue, it is a gender issue, it is a social issue, it is a national issue. And I think only when we all come together, women need men, men need women, we all need each other. And as long as we have each other's back, just as human, as mankind, I think we really can fight this disease. And men have such an important role to play, just as much as the women do. And I think we can do it.
Amazing. I think that's very well put. I would just like to highlight one point that you mentioned, which is about we shouldn't just go home and pass on some instructions.
Yes.
Okay, this is also something that you have to do.
Yeah.
Instead, create a safe space to talk about it and also offer support and facilitate this, right?
Yep.
It's one thing for me to tell everybody at home the drinking more water is good for you.
Yeah.
But it's quite another for me to just keep water next to where you're sleeping.
That's amazing,
you're much more
actually.
likely, much more likely to have it, right?
Just book a screening and be like, now you have to go, sorry.
You book movie tickets and whatnot, right?
Yeah, you book surprise movie tickets.
Yeah.
And just book a session for them and just be like, now you have to go.
Yeah.
And in most cases, Indian households, we will not let that money go to waste. So we'll just be like, okay, I'm just going to go get it done.
Yeah.
Yeah. But I'm just kidding. I hope they all willingly go get screened.
Yeah. And I'm super happy for the audience who's listening to this and feels that they're completely okay and safe from it. And I really wish that you do remain that way. But like you mentioned, 100% of the women are at risk for breast cancer at some point or the other.
Yes.
And so screening is for everybody.
Yep. Of course, for most women, it's much more important, which means you cannot miss it, which is above the age of 40. But this disease is presenting itself to a lot of younger 30-year-olds too, which means that we are all still at risk. So we should not deny it from ever happening to us because we're young, because the world is changing and not for the good in a lot of ways. So all women should get screened for breast cancer once every 3 years, once every 2 years if you're above the age of 40, period.
Right. So everyone listening can help in this cause.
Yeah.
All the women, first thing they need to do is do a self-examination, educate themselves more about it, look up UECAN website and they can find a lot of information there.
Yes.
And then if they see any signs, and even if they don't, like somebody who's never gotten a screening done, they should, right?
Yeah.
And by this,
yes.
if you're in your mid-30s or 30s, whatever.
And there are a lot of painless procedures, radiation-free procedures that exist. If it's the pain that you are scared of from, going through it, I think the bigger reason keeping them away is the fear. And I think that's when your partners, if your husband, if your brother, if your father, if you only have a father in your family and you can't really speak to your mom or your sister about this, you have to speak to your father about it, and your father has to be there for you. So I think the fear of knowing that, what's going to happen, and I think a few words of affirmation and love from your loved ones and from the people in your family, it can really go a long way.
Beautifully put. So I was just rounding up, or everybody listening can help in some way or the other. So all the men listening, like you just said, they should initiate a conversation, create a safe space, book a screening perhaps, right?
Yeah.
And anybody who's working in a corporate, whether it's a male or a female, they can also speak to their HR and organize some screenings that you guys do.
Yeah, I think we've done this in the past and we've seen great response, because even after having access to information and all of the health services, there's still a lot of information that gets missed out by these people. It is just as new as it was for you, as it was for that lady in Banaras. We all have been victims to the lack of this important information. So I think if you have an HR in your firm who deals with employee engagement activities and employee wellness activities, to just hit them up and to just ask them that if an awareness session or if a breast cancer screening camp at the workplace can be organized, and the employee wellness will provide for better productivity at your workplaces, and such great fulfillment to know that I'm all right. Now I know. Now I've seen that everything's all right with me, instead of just assuming that, everything's rainbows. So, yeah.
Excellent. What a conversation. Thank you so much for making us aware about this. I think I've learned so much through this.
Thank you.
And I am sure, I think all of us are influencers, like micro influencers in some ways, right?
Absolutely.
If I know, let's say 20 females in my life, all my cousins, sisters, or my mother, my daughter, everybody included, let's say 20 females, if I can ensure that they all get screenings done, they're all safe,
Yeah.
then I think I've done my job. And everybody listening to this, if they do exactly the same, just watch out in their neighborhood, in their family, and I think we would have done a job.
Yeah. Early detection does save lives. So even if you talk to 2 people about it, that's 2 lives that you have tried to save. And as per the Quran, even if you're able to save, 1 life, that's you've achieved all that there is, all that there was to your existence. So I think we all have a very important role to play in this life, and we all can start from home. And I think together we can fight this disease.
Let us hope we can fight this all together.
Yes.
Thank you so much for your time.
Thank you, Vipin. Thanks for having me.